I am Shay, and I have three kids, two girls and a boy. I'm from LA. My two daughters have sickle cell trait. They're pretty healthy kids. But my son, he's the youngest, and he has sickle cell disease as well as I do. I do have sickle cell and a bunch of other things, but that's my main diagnosis right now is sickle cell because I was born with it. Accessing healthcare here has been a challenge because there is not a lot of access to pediatric hematologists. Not a lot of them have the knowledge of what to do with my son, especially in hospitals. It's very hard to find the help that he needs when he is sick.
I'm sure that's been so interesting coming from moving from out of state into Las Vegas.
Mm.
What has been the difference?
Oh, yeah, there's a huge difference. In LA, there are children's hospitals that know how to take care of kids with sickle cell, and there are so many hematologists that specialize in just, sickle cell and how to treat kids with sickle cell. Out here is a big difference because I've noticed that doctors do not communicate with the hospitals, and the hospitals don't have full access or don't understand the disease as well as they should. And so treating kids is very hard to find the help, even in the hospitals. And then there's no doctors who communicate with the hospitals to say, okay, this patient has sickle cell and this is the care that they need. Nobody talks to each other out here, and I had no idea that was the case when I moved out here. It was very, very different.
As a parent, what is it like trying to navigate a system that's fragmented like this?
It's frustrating, terrifying because at any moment, you don't know what your kid is going to go through. I find myself being a very helicopter parent, hovering over my son just because I want to make sure that he is as healthy as possible. A few years ago, he had a very high fever, and I took him to the emergency room to get him treated. And they ran some tests, but they didn't really say what he had. I explained to them that he had sickle cell and that we needed to know what his blood levels were and to treat his fever. They sent me to a different hospital because they didn't specialize in pediatrics anything. So they sent him to a different hospital, and they did the same thing. They asked me a bunch of questions. We waited in the emergency room for at least 2 hours, and then the doctor that came in explained that he had a high fever, that they were going to check for different viruses. I asked them again, can they run his blood so that we can know what his blood levels were, just to know, if he's going into a sickle cell crisis or not. And the doctor said that they don't really specialize in that, but they did know that he had RSV. And I guess with sickle cell patients, if you have any type of virus, it can trigger a sickle cell crisis. So I explained to them again, we need to run his test. We need to give him a chest x ray. They said that they were going to transfer him to a different hospital because they don't have the access to doing the things that they needed to for him. So I personally took him to another hospital. And that was a whole nother thing because I, again, had to wait in the room for about 90 minutes for him to get seen and treated. And they finally, admitted him for 2 days. But when they admitted him, we went on the floor that he was supposed to be on. They said that if they can't help him here, that we would have to go to a different state, to a different hospital. I'm so lucky that he has been healthier than he was back then. But again, I think that's because I am a helicopter parent and I make sure that I watch every symptom that he has. If he's fussing a wrong way, I am just like, okay, very overbearing. And I can tell because he's kind of like, okay, well, back up.
Mhm.
But it's very hard because I didn't expect the healthcare system to be what it is out here. And I don't want to go through that. that roller coaster ride of different hospitals, because that's not only frustrating for me, but it's frustrating for my son. You know, as he's sick, he has to go to these different hospitals getting poked several different times, all these tests that they have to take, and a bunch of different doctors and nurses hovering over him because, the the first hospital that we went to, or even the second hospital we went to, just did not know what to do about it. It wouldn't have been the same if I was to take him to LA. And half the time I feel like I should take him there because I know that they have the doctors and the healthcare system that will do what they need to do to get him healthy.
What would it mean to your family to have a freestanding children's hospital here, to have the specialists, specifically the pediatric specialists?
It would alleviate so much stress for sure because I know that the doctors would communicate with whoever it is in that hospital. Having pediatricians, communicating with other doctors and hospitals helps a lot when it comes to that patient, because not that patient may not be going through just one thing. They may have a lung problem or a heart problem, and if the doctors aren't communicating to see what they can do for that one patient, it's very hard, for that patient to get the health care that they need to live their best life, So it would alleviate so much stress for my family, for my son, if Nevada had that.